Okay, so in this video we will see what is ASD. So that is atrial septal defect, and it is commonly asked question. It is an example of acyanotic, and here you have increased pulmonary blood flow. Okay, so here what is happening? Abnormal opening between the atria, allowing blood from the high pressure left atrium to flow into the low pressure right atrium. So what is happening? There is an abnormal opening between the atria that happens. That's why we call that to be atrial septal defect. Okay, so this allows the blood flow from the higher pressure to the area of lower pressure. So under types you have, there are three types of ASD, that is Ostium Primum ASD1, opening at the lower end of the septum. So in the septum, if this is the septum, okay, if in the lower part of the septum, if there is a opening between two atrium, there is a septum. Okay, abnormal opening is called as atrial septal defect. So you have three defects or types, okay, down, middle and up. Okay, so if the opening is at the lower end of the septum, it may be associated with mitral valve abnormalities also, and we call that opening to be ostium primum. Okay, primum. Then you have ostium secundum. It is an opening at the center of the septum between two atria. And then sinus venous, okay, and then sinus venous defect. It is an opening near the junction of superior vena cava and right atrium. So this opening is somewhere close to the superior vena cava and the right atrium, which is a sinus venous defect. Okay, so these are the three types. Next we will see what are the clinical manifestation. So patients may be asymptomatic, they may develop congestive heart failure. So in all the conditions we are seeing that the child will develop CHF. Okay, so it can be sometimes asymptomatic, as we have seen. It is also acyanotic, and there is a characteristic murmur. When you auscultate, you will hear abnormal sound. Patient at risk for atrial dysarrhythmias. So almost all the cardiac conditions is the same, but you should be careful when you're writing about acyanotic and cyanotic. Then surgical treatment, they will make a patch. They will try to close the opening. Surgical patch closure is done for moderate to large defect. Open repair with cardiopulmonary bypass is usually performed before school age. So before the school age, once when they find out, they will do the patch correction. Non-surgical treatment, what they can do, that is for ASD2, okay, where the closure is in the center. So here the device through cardiac catheterization is becoming commonplace, and can be done as outpatient procedure. So outpatient procedure, they will just ask the baby to come. Cardiac catheterization means through the femoral artery they will enter into the heart, okay, and directly they will correct the opening, okay, and then the child can be discharged, okay, after observation, okay, or they will send it as they are doing it as a outpatient procedure. So once when the catheter is sent through the femoral artery, then the catheter will be removed and pressure will be applied, and then after observation the child can be sent. Okay, next we will see what is VSD, that is the ventricular septal defect. So when we talk about ventricular septal defect, when we talk about the description, it is the abnormal opening between the right and left ventricle. Okay, so there it was between two artery atrium, and here it is the opening between the ventricles. May be classified according to the location, membranous 80% or muscular. So it can be membranous, which is mostly of 80%, or it can be muscular. So may vary in size from a small pinhole to absence of septum, which result in common ventricle. So the size can vary. It can be just a small opening, or it can also vary with the size. Ventricular septal defect are frequently associated with other defects. So usually when the baby has got any other defect like TOF, we have studied there, one condition is where the baby has VSD. So mostly this VSD, ventricular septal defect, is connected with various other disorder. And remember, in tetralogy of Fallot, this is one of the condition. The TOF is the one of the condition. Okay, associated with other defects such as pulmonary stenosis, transposition of great artery, and coarctation of iota, etc. Those are the examples with which this VSD can occur. Clinical manifestation, CHF is common, as we have seen. Characteristic murmur is seen. Patient are at risk for bacterial endocarditis. Okay, so the inflammation of the heart, okay, endocardium can get affected with bacteria. So this we have to remember. This is one of the extra point in VSD. Okay, the non-surgical treatment, device closure during cardiac catheterization is being performed in some center under investigational protocol. Once device has been approved for closure of the muscular defect and another is in clinical trial. So what do? They do the cardiac catheterization, same through the femoral artery. The catheter will be sent and then investigation protocol will be done, and through that, okay, device has been approved for closure. They try to close the VSD opening that is found. Okay, so surgical treatment again. So this is non-surgical without opening through catheterization. So when we say surgery, palliative is pulmonary artery banding will be done, maybe in infant with multiple muscular VSD or complex anatomy. In severe cases, they will try to do the pulmonary banding. Okay, so complete repair, when you see small defect are repaired with suture. So they will make suture and then complete repair will be done. Then large defects usually require the knitted Dacron patch be sewn over the opening. So this is very important and mainly used. They will knit. There is a patch called as Dacron patch. They will put that and they will try to suture in the opening of the ventricle. Then cardiopulmonary bypass is used for both procedure. Okay, so they can also do cardiopulmonary where they will open up and they will do the procedure. Okay, so that is with VSD. Next condition is coarctation of iota, and coarctation of iota is also one of the severe condition where the patient has, and it is the example of obstruction of blood flow. Okay, so when we say what it is a localized narrowing near the intersection of ductus arteriosus which result in increased pressure proximal to the defect and decreased pressure to the obstruction. So the iota is actually getting troubled here. So what exactly happens is